Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors. Hello, and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Hi guys! Happy Halloween! This is Dr. Santhosh, your pediatric infectious disease doc and researcher.
And joining us is special guest, space pharmacist, Eleanor O Rangers.
Ooh, happy Halloween, everybody.
Now,
the great part is that wasn't for this episode. She does that all the time.
Exactly. I start every conversation with,
I admit, I'm already more interested in whatever you're about to say next. So I applaud this conversational technique. We have covered a lot of different kinds of monsters and myths and legends over our Halloween special years, Santhosh.
Yeah, and it's been not quite as fun as our comic book medicine episodes, which I personally love the mostest. But this one is like, a slightly lesser loved, like redheaded child. Oh my God, we just lost all of our redheaded listeners.
Both of them. And I was thinking to myself, what terror that goes bump in the night have we not covered on this earth? And there really isn't a lot. But then I started thinking, what if it was not of planet Earth?
Oh, man.
No, actually, we need the theremin going.
The theremin? Why do we need a theremin? We have a human theremin. That's awesome.
So I figured let's talk about, and, to bury the lead, that is why we've brought our space pharmacist along. We are going to discuss the, taken with a grain of salt, medical possibilities of alien abductions.
Oh, yeah. amongst other things, this will kind of be not our exobiology episode, but I think there's a lot of fun that we can have with this, but we can still use scientific method to narrow down the probabilities of what life is like out there, and then what that life out there would do to us should they abduct us.
Is that probability or probabilities?
Oh!
I'd like to note, this one didn't start with me.
No, it didn't. That was completely unscripted, too. Josh, she's gunning for your job. Watch out.
Well, part of the reason I was also thinking about space, and Eleanor, you probably know about this, is the recent failure of launch for the Artemis mission.
Yes.
And I saw a tweet just making fun of it where it was NASA said, "Oh, hey guys, you're back early." And the astronaut steps out and says, "Moon's haunted." And that's when he says, "What?" And then astronaut loading a pistol into his suit, stepping back into spaceship, "Moon's haunted." And then just full stop.
Which is, if it's a haunting though, what in heaven's name are you going to do with a gun? That's not, you need a proton pack.
Or a ray gun, for God's sake.
Yeah.
I like that that's the only part of it you see as a question. When we talk about alien abductions, what are some of the first things that you guys think of? What are the images that come to mind?
Eleanor?
Oh, the first thing that comes to mind is actually a movie that scared the living crap out of me as a kid.
Oh boy!
It was a movie called Fire in the Sky.
Yes,
and that the famous scenes of D.B. Sweeney on the alien spaceship and what he encounters, and then undergoing, the physical exams or whatever the heck they were doing.
Yeah,
that was incredibly scary. And a lot of it was classic things that you hear about with abduction, that you're kind of strapped down, that they may be doing something unanesthetized. And it's usually something probing the head, the brain, genitalia.
Yeah.
Those are kind of the classic things you hear about.
That one, I think that was one of the creepy ones where they put you in the perspective of the abducted person.
Yes.
And then, like, you saw the thing coming towards your eye, like the
Yep.
needle.
Yes.
That, especially if you're a young person, oh my God. Like, I still, to this day, every physician has some bugaboo. Like, oh, I can do gore and blood and guts and all that kind of thing, but I hate this. And for me, it's, anything to do with pathology of the eye. It scares the living daylights out of me. And I think part of it is that movie for sure.
Oh yeah, no, that movie always stands out to me. It's incredibly frightening.
Oh God, I don't think I have one to top that. I will go a little bit more esoteric though. Of course, because Eleanor, I think you and I are both Trekkies.
Yeah, absolutely.
And so the Next Generation, when people were having blackouts aboard the Starship Enterprise, and they found out they were extra dimensional beings that were actually, taking humans into their dimension, experimenting on them and put them back. And I think the one that got me was when Dr. Crusher is examining, I think she's examining Riker, and she goes, "That's interesting. Your arm has been severed and then replaced." I was like, what? And she had the tricorder and everything shows all the tissue planes in your arm are 5 microns off, which of course now that I'm grown up and everything, that's absolutely nothing. That's fine. So, but there it's like offset, and I was like, they did what?
How about, I don't know, at least 3 seasons worth of episodes from the X-Files?
Oh my gosh. Well, there's so many classic tropes
abduction
from that.
Yeah.
You would think, how far back do these go? When was sort of the first abduction? Because everybody knows this story. But where's the story from? It turns out it's really fairly recent. We only go back to about 1961, at least for the abduction version of alien interactions. People have, of course, been talking about interacting with aliens for years, but, we've gone from building the pyramids to abducting and probing people on back roads. When did that change? So just very briefly in terms of history, we're talking about 2 people, Betty and Barney Hill, the earliest known victims of alien abduction, and this is from their book, 1966, The Interrupted Journey, where they underwent hypnosis to recall the event.
Sorry, were those the same 2, like the husband and wife in the Flintstones? Was that Betty and Barney Rubble, right?
It was.
Yeah. But it was like, as soon as you said like Betty and Barney, I was like, Yeah.
Well, I won't go too much into their story. There's actually several other podcasts that cover it, but the reason that they're sort of held up as the prime example is they were the first ones to report seeing, lights in the sky while driving on a back road, thing blacking out when seeing the light approach them,
missing
waking time. And they really didn't want to come forward to talk about it. The journalist who got their story did so kind of very underhandedly, published it without their permission, and then they just sort of made the best of a bad situation. But they gave individual yet similar accounts. They have stuck to their story for many years, and only later did they sort of start to embellish and try and build on to say that they were special. But in the beginning, they're just like, we don't know why this happened to us, could have happened to anybody. And a lot of the common tropes that they talk about are discussed. So I want I want to approach this from a couple different angles. This is not to mock those who believe they've been abducted or who believe in alien abductions. I really want to look at the medical aspects of this. So if we take this as
So you're saying that we have to get all up into this and maybe get inside.
I'm saying it's an unidentified object.
We have to dissect it and maybe. Yeah, okay. All right.
There's a lot of area to cover. 51 of them, probably. So
Nice.
But let's approach this first from the skeptical point of view. What could be similar to these? Well, many of the frequently reported details of abduction sounds a lot like surgery.
Oh, yeah. As in being anesthetized, and accounts that people have of remembering their operation. Some even having like out of body experiences, like seeing their own body from above being operated on.
Yeah,
or night terrors too. Dreaming and
that's a great one. Yeah, night terrors is another possibility. But for surgery, let's see. You have an altered state of consciousness. Mm-hmm. You've got uniformly colored figures with prominent eyes.
Oh, especially if the surgeons were wearing loupes. Okay, yeah, like they'd make their eyes look all buggy.
Not to mention masks. So you don't, to somebody who is altered, you're not going to have a mouth. That's it. The only recognizable feature is eyes in a high-tech room under a round, bright, saucer-like object. Ooh. Are you seeing the parallels? There's nakedness. Yeah. There's pain. There's a loss of control while being probed.
Oh, sure. And especially if, poor thing, if she suffered paralysis from a paralytic, but the sedation that was actually keeping her unconscious wore off, she would feel trapped. She'd feel locked in.
And in terms of the body's boundaries breached, intubation, catheters, rectal tubes, needles, the surgery itself. These aliens were not taking any kind of medical history, which means they could be from outer space or they could just be surgeons.
Question is, though, if they are surgeons, do these experiencers or abductees have any evidence of being surgerized? And I mean, there's been reports of supposedly having implants, but and maybe scars or tiny marks, but I don't know if they've had, like Riker, where his whole arm's been severed and put back.
Yeah. That was I'm telling you, I don't know why that did things to my mind. Oh my gosh.
Yeah, that was the one where some of them were remembering like the sound of the aliens, the instruments going click, 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 click.
Oh yeah, it was more like whispering or clicking. Exactly. Yeah.
And then they reproduced the examination room in the holodeck. Yeah, that was a good episode.
That was so good. Are we going to turning into just like a Star Trek episode review podcast? One of the very few Star Trek episode review podcasts out there.
But you do bring up a good point. What about scars? Well, let's talk repressed or traumatic memories, or even just memories that you've, for lack of a better word, aged out of. Surgery in childhood with the amnesia for childhood could just lead to a scar that you didn't notice until you underwent a different kind of surgery, or a surgical scar itself. So there is the skeptical point of view could claim that these are all very similar to experiences that you just undergo, and maybe they are simply having memories of a previous surgical experience.
Oh, sure. Like a flashback.
Yeah.
Got it. Okay.
And to support this point of view, a study was done. See, there's still science involved.
Okay.
We've got a couple different studies. We can dissect them later to see what sort of things we can pull out and discover. But we're at least bringing something to the table. So to look at what generally happens in traumatic or repressed or dissociated memories, often, at least in the field of psychology and psychiatry, it's thought that people do this to protect themselves from a traumatic event. But even when it's repressed, it can still be remembered. So to study this, a researcher took women with recovered memories of abuse and did a study employing something called the Dease-Roediger-McDermott paradigm, which now I'm not entirely sure how these two relate, but it measures recall of words not actually present in a list of related words. And
okay. So basically, I remember that word being in that list, even though, you didn't read that word off to me.
this was one of the problems with the study, because they did a guided imagery study with a bunch of MRIs on various women who had undergone or claimed to undergo abuse, whether physical, mental, emotional. Just they collected women with abuse, and the study that was linked wasn't described in a lot of detail, so some of these could also be problems with the design. But it showed that people with repressed memories were more given to false memories in a lab setting. Now, it does not say that they were more inclined to lie. It doesn't say that they were making things up, but they were more prone to have false memories based on this recall of unrelated words. So researcher Clancy found that a lot of people basically disapproved of this research, feeling that it ultimately was questioning the validity of sexual abuse. So
I see.
hypnosis and recalled memories of abductions really aren't going to be a reliable way to learn about our alien brethren. However, this was not the intent of Clancy's research. They wanted to know, how good are repressed memories? Can you actually recall them? So instead, a different researcher, John Mack, held an interdisciplinary brainstorming session on alien abduction, taking it just as we are at face value. And this was done in the way ancient days of Prepare to Decay, 1999.
Yeah.
Space,
Yeah.
1999.
Yeah. Oh, so long ago, in the mists of time.
Right? But impressed with the idea, if not necessarily the execution, John Mack and advisor Richard McNally asked Clancy to collaborate on a study of physiology while remembering the abductions. So something that couldn't really be as subjective. So by newspaper ad, because newspapers still existed in the 90s,
Wow.
they obtained 50,
Okay,
50 cases of people who claimed to have been abducted and ruled out the psychotic ones who called from, and this was some of the ones who they sort of eliminated. They had called from either hospitals, halfway houses, shelters, or detox units to tell me things like aliens had switched their brain with that of Britney Spears.
Okay. Okay, all right.
So they were looking for people with stories more like The Hills. I had been abducted, I lost a chunk of time, later it came back to me and I remember some sort of mental probe, unless they put it in my teeth or they switched brains with Britney Spears or things like that.
Sure, okay. All right.
In her book, Clancy notes all the abductees began to wonder if they were abducted only after they had experienced anomalous situations. So some kind of trigger event caused the return of this previously repressed memory. The general plot stays the same: kidnapping for medical or sexual experimentation. Certain details often stay the same: big heads, wraparound eyes, probing needles. But at this point, it's so sunk into our pop culture that with every successive story, the previous one becomes a little unreliable, because are you actually remembering your experience, or are you conflating some repressed memory with what everybody knows about aliens?
Oh, yeah, this is kind of like the Mandela effect, which is, it relates to all of us sharing a false memory just because it's been perpetuated in popular culture, just talking to each other. So other examples of this include, a lot of us remember Curious George, as having a tail.
Or the Berenstain Bears.
Bearing the Berenstein Bears rather than the Berenstain Bears. Yeah, absolutely. So there's lots of. It's so funny how we edit our memory, not just in the past, but as we live life, we're actively editing. So our brain is not like a camera that captures everything. It's much more complex in terms of how we form memories. And the biggest problem with that is that it's kind of sort of really unreliable.
So that gets us to, how are you going to test this hypothesis? What would you guys do to standardize our examination of alien abductees? So on the human side of things, somebody comes to you and says they've been abducted. What can you do? How are you going to rule this in or out?
Oh, I mean, if it wasn't humans, if it was animals, I just tag a bunch of them, geotag them, and see if
tag them. Do they leave this earth or come back?
Yeah. And if I lost any signal, and maybe see if I can. No, that's not the right thing to do. That's really mean. That was facetious, partially, mostly.
Okay, well, first you could start by taking a complete medical history with an emphasis on surgical or anesthetized procedures.
You take all the fun out of it. I just want to geotag some humans and just see.
I'm not saying you can't.
Yeah.
I believe Apple calls it Find My Phone or Find My Friends.
There you go. Yeah.
Sure. Oh, that's awesome. I think it would be awesome if that's how we found out that alien abductions were real, that all of a sudden a bunch of like Apple Watch users just start disappearing, like it just bloop.
According to Eleanor's Apple Watch, she's in space.
Exactly. I'm circling the moon right now, unlike Artemis 1.
No, look at, she's back in San Juan Capistrano.
But again, approaching from this skeptical side,
sure.
Really emphasize what surgical and medical procedures, how many, when, go as far back as dental, as childhood procedures, and then if, from a surgical aspect, look at what kind of anesthetics they may have received or any kind of consciousness altering pharmacological agents they may be on. Ambien, I'm looking at you. Similarly, trazodone, any of the benzodiazepines, things like that.
Just to be very fair, I know this wasn't the case in what we're about to talk about, but I would love to actually have a control population also of folks who had undergone those types of procedures, received those kinds of drugs, but didn't have any alien abduction accounts. So, because that would at least help trace, a little bit of correlation.
Well, your control is the rest of the population, unless you're assuming that everyone who's had surgery is also an abductee.
Okay, that's fair. That's very fair.
And we're talking about if an individual comes to you, not if you are setting up a large-scale study. Although we will check back in on that large-scale study.
Oh, okay, cool.
So you do this full history. While you're asking these questions, you can also monitor heart rate, body temperature, respiratory rate, the things that we call vitals, and see how they change. Somebody with PTSD, from whatever reason, is going to start having elevated reactions when put in even the memory of a triggering situation. Now, whether this trauma was caused by alien abduction or some experience that's conflated with that in terms of pop culture, again, really hard to separate out. That's why you're looking for anything that may help rule out. So this is what we call alien abduction would be a diagnosis of exclusion.
Absolutely, yeah.
But let's ask about the alien side, because this is where the fun comes in. What are the aliens checking for? Let's say they are aliens, right? What's their bedside manner? Do they make you wear humiliating paper garments in space? What's the reading material?
Well, one of the theories that's out there, and of course this was something that was carried on in the X-Files as an interesting storyline, is that aliens are trying to, when they're examining our reproductive capacity, collecting sperm, other types of specimens, it's to figure out how to clone us or how to merge their DNA with our DNA for some unknown purpose. Is it to colonize the Earth? Is it to, take us and bring them and enslave us on their planet? Who knows?
That seems inefficient.
Well, it would have to do with a little bit like how the aliens relate to us in terms of, so we view ourselves, for better or worse, kind of as superior species. I think that's fair enough to say, by and large, when it comes to, for instance, insects. And, if we're studying mosquitoes and we want to know everything about them, then there's going to be some scientists that are studying their reproduction, other that are studying their feeding habits. Some now, we're studying now chemoattractants to see what attracts them to blood and that kind of a thing. And because they're simpler, really, in terms of everything about them, we manipulate this, we change that. Sometimes we manipulate something and then put them back into their habitat, for instance, their genetics, to actually stop their reproduction so they don't spread malaria and other horrible diseases. So, like, if the mosquito was going like, dude, I'm telling you, I was totally abducted and they messed with my genitals.
Right.
And everybody else is like, just, all right, Frank, come on.
We're a lab animal.
Yeah. So,
how do we know the aliens are so advanced? I mean, the assumption is that they're super advanced, more than
right.
we are.
So in which case we would be like the insect. So they're just
right.
They're just trying to learn. They're just like, oh, this is an interesting species. Let's crack it open and see what's going on.
Yeah.
And it's like, oh shoot, I killed that one. Oh, it doesn't matter.
Oops.
Or
Well, that's why I think the clone ideas, again, seems inefficient given how fast humans seem to reproduce on just a global scale, as well as transporting somebody light years for slavery purposes.
Yeah.
While I'm not saying couldn't happen, again, just seems like inefficient use of space resources to come all this way. Now, if you're looking at the hybrid theory, well, that's been answered a couple different ways in The Outer Limits, in various Star Trek episodes. But the interesting thing is, for a super technologically advanced race, we've already found a way to start melding or hybridizing DNAs. We haven't worked with human except in one rather scandalous case in China, because we're talking about, of course, CRISPR.
Yeah. So this was, genetic manipulation to kind of see if we could. That was definitely on our own species. Unfortunately, it was the wrong thing to do, absolutely. But that's possible. The other thing I'm thinking of is, Josh, you and I have covered a lot of articles recently about human-pig hybrids. And that's specifically so that we could grow organs in different animals so that we could cut down on the number of transplants that we need, so that we don't have to rely on someone becoming brain dead or donating a kidney. We could just grow the organ in a, pig or something like that. So if our physiologies were close enough and they were like, hey, we can, grow some whatever
genitals?
Weird organ. No, not genitals. It doesn't have to be genitals, but it,
But what's being operated on in all these alien abductees?
No. But there's
like we're growing pig hearts. They're growing human genitals.
Yeah.
Didn't Futurama look at this? Maybe our genitals are some sort of aphrodisiac for aliens.
Oh, human horn, the human horn. Yeah. Okay.
But so that's one possibility. CRISPR could be used to hybridize for not necessarily alien-human hybrid creatures, but organs that can be used to whatever purpose, assuming some kind of physiology is similar enough. All right, I'll take that. So genetic research and surgical research, because you're talking about taking biopsies, whether it's a bone marrow or genetic sampling or things like that. If you are in the alien's position, or we're humans and we discover some new alien race and we decide to, unlike Star Trek, since that's what this is a episode now of, let's say we flagrantly violate the Prime Directive and we start abducting creatures from some other planet, what sort of tests are you going to want to do to learn more about them? Separate from all the massive ethical ramifications
Sure.
of experimenting on a creature with an unknown level of sentience.
I'd want to basically understand their physiology. I mean, are they, what's their DNA composed of? Are they a silicon-based life form, an arsenic-based life form? I'd want to understand that first and foremost. What does their life consist of that differs from ours?
Yeah, so you could look at chemical makeup, physiologic response. So, Eleanor, we actually do this quite a bit with, animals here on Earth, especially if the animals are fair analogs to ourselves, is we do run things like pharmacokinetics and things in terms of, how quickly do they metabolize this drug, or what is the effect of this medication on this organism? As for instance, like I know there's a really common set of photos out there that shows a particular spider on various drugs and how it weaves its web. So, spider weaving its web on methamphetamine, cocaine, opiates, and that kind of a thing. And the shape of how it weaves actually tells us the behavioral effects of the drug, and thus the physiologic effects of the drug on the organism. So that could explain a lot of, implant this and they gave me this drug and that kind of thing.
So, without overcomplicating things, so could, again, simply anesthesia or any kind of sedative. I mean, look at GHB, also known as the date rape drug. Look at most sleeping pills out for just casual consumption on the market. All of them can cause alterations in consciousness. So we could simply be, or to put another way, Santhosh, you research occasionally with animals, correct? Mice?
Yes, primarily we're a mouse lab.
And you usually have to sedate the mouse to either do a procedure or ultimately compassionately end its life for science.
So by our ethical standards, we absolutely, and this is fairly recent, but you can actually have your lab taken away by violating some of these ethical standards. You have to completely sedate them, and then the method by which you euthanize them has to be a specific way, which almost guarantees that they feel nothing. Yeah.
So standardization of procedure on your experimental population.
Mm-hmm.
And even though you are not a mouse, you by now know the mouse-sized dose to give to achieve that level of sedation, right? And this is where the pharmacokinetics that Eleanor knows also come in. So I would think that the fact that all these stories start to sound similar, if we take them as real, the reason everybody has slightly different recollections is the aliens have had, over the course of since the 1960s, presumably till now, figured out the right anesthetic doses and what compounds to use, whether or not they are human equivalent compounds or alien compounds that work on human bodies.
Sure.
So, Eleanor, how would we decide what the dose is for a creature that we know nothing about? So even if, let's say, you send me to do a internship with a veterinarian.
Yeah.
And the first day they're like, I need you to sedate this pig. What's an approach I'm going to take? How am I going to know without, if I don't have a pharmacist there to correct whatever dose I'm about to give?
Sure.
Well, it's interesting. I recently listened to some continuing ed on veterinary considerations with dosing, and actually, one very basic tenet is you can't assume that human physiology is necessarily has any similarity to another species. They may have some, but not all. So that's one. I think that's one issue that the the aliens are going to have to probably they're going to make a reasonable assumption, assuming that they're of course a superior being and probably have similar logic to what we have. They're going to assume, okay, all of these like two-legged hairless creatures running around this planet probably have similar physiology. So I'm going to look at their body size and probably make some reasonable conjecture. We have to also assume, does pharmacokinetics and dynamics even exist in their alien world? I don't know. I think it may be a bit of hit or miss. And they probably just learn from experience, which is why they have to keep abducting people. And also, note, there are some cases where people claim they've been abducted over many, 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 many times. So maybe they're retesting in that one person as they age, just to test how their response is to these different doses.
Oh, that way that individual is his own control.
Own control, exactly. Yeah.
I see. Whoa. Creepy.
So now you've got, several different disciplines. You've got the long-term case reports, and now let's design our abductee population, knowing little to nothing about Earth. Where are you going to want to abduct from?
Well, abductions, to my knowledge, in my vast knowledge of abductology, they've been reported all over the world. There's also a famous case that John Mack documented of not abduction, but of a UFO scenario that multiple children of both I guess African American and Caucasian descent witnessed in Zimbabwe, and all these children sort of experienced the same thing, and what they observed. It's just an example of something that happened in Africa, but I know there's been reports in all over the world, to my knowledge.
So I think
so it's equal opportunity abduction.
Yes, that seems to be consistently, as you mentioned, all over the world, multiple genders, a range of ages, all getting a similar type of test performed on them. So we've talked about CRISPR and hybridizing for organs. We've talked about kind of testing different anesthetic or drugs that may be designed for other than human physiology, or may just be to sedate us while other tests are done.
Yeah.
You've talked about having control groups versus randomized ones.
Yep. And they're getting a diverse population if they're abducting all over the world.
So if I were to examine this and look for things now, again, let's drop back over to the human side of this. If I were looking for aliens from a scientific, I guess, statistical perspective, I would try and start finding all these groups, collecting them, and looking to see what are the similarities among them. So say, for example, we notice that there's a larger cluster of abductions in countries that are more populated, but it always occurs in less populated areas of those countries. So you're looking for areas of scarcity within high areas of population density. And that, oddly enough, is what we see. People aren't getting abducted from downtown New York, Chicago, or Los Angeles.
Oh, there was a report of abduction in Brooklyn.
Oh, okay. Occasionally, then.
Occasionally. But yeah, most of it's like Fire in the Sky, where it's like a bunch of loggers out drinking and they report an abduction.
Yeah.
But similarly, when you look at reports from China, from Russia, from India, and from Kenya, which are some of the more populated cities around the world, again, you're not seeing, even in say when you compare Nairobi to Chicago in terms of population, um, even though one may be less, you're not going to see more abductions in that smaller area. You're going to look at the high density major towns, and then just outside, although I wish I knew what kind of distance, like 20 miles, 50, how far out do you have to go, or does it just become rural? But once you start hitting lower density populations. So why would you do that, do you suppose? So these are some of the known facts. It tends to be higher density countries, but in lower density areas. Why would you select your population study that way?
Because you want to try to be as secretive as possible.
Yeah, well, or if you're saying you're a superior, kind of whatever in terms of the intellect and stuff, create the least amount of disruption in terms of like social disruption.
It's just like, gorillas in the mist. You're studying the gorillas, but you don't want, you're in a blind, so you don't want them to know that you're like observing them.
Yeah, because then your observation will actually like screw up the experiment. Possibly. Maybe. Is that what you're on, Josh, or you have a different hypothesis?
Yeah, no. This is what I want us to think about. Before we go back to just dismissing out of hand, let's say, what's the medical rationale? What's the scientific rationale behind these decisions? All right, so now we know why we're picking areas. We don't want to, so now it sounds more like it's anthropological research.
I guess, but to some degree, I mean, but if I really ultimately wanted to learn about, okay, I actually want to learn what, the majority of the population is doing in terms of their physiology and whatever it was, like I have to get down to it and start taking large samples from the population center, because otherwise you're just getting kind of like a skewed population if you check on the outside.
Yeah. So although I don't know if we've ever heard of mass abductions, have we?
Well, yeah, and that's the other thing that's kind of missing, right? So when we do wildlife research and that kind of a thing here on Earth, it's you're trying to get like groups, and then you pick them up and you sedate them and you tag them and you send them out, right? So you only get singlets if they're really large, predators and stuff like that, like big cats or rhino.
The only other explanation I can come up with is, one or two people from every rural area on Earth would still provide a pretty decent sample size population, without having to worry about secrecy or disturbing the natural flow. If you're literally just pulling one person from, out in the random area, they're an outlier for their city. But If you collect even a population of 1 billion outliers from every city, you've still got a pretty good representative sample.
Yeah, there you go.
I'm trying to think of an entomologist. Like if you were studying ants, for instance, yeah, I guess you wouldn't go down, like you wouldn't scoop your hand into the middle of the nest to get your ants. You'd catch the ones
not more than once anyway.
Yeah. You'd get the ones that were patrolling and going and getting leaves and stuff from outside of the hive or the nest. Yeah.
Now, let's look at one other aspect of alien abductions. What steps are they taking to protect themselves from us? Famously,
alien PPE, you're saying?
Well,
yeah.
Let's look at one of the most famous alien abduction or alien stories and disease, War of the Worlds. Spoiler alert for an over 100-year-old story.
Yeah.
But do you know what ultimately kills all the Martians who attack Earth? COVID. I'm sorry, the common cold.
The common cold, yeah. There was one War of the Worlds where I think, was it Morgan Freeman who he narrates at the very end?
I think you're thinking of Armageddon. Or is it Armageddon, or the one where...
No, it's not Armageddon. But the line is a very poetic one. These great and powerful beings were felled by the smallest and simplest of us. Those creatures that we had been able to coexist with by trial of life or death and immunity earned over millennia or something like that. It was a really beautiful like closing to that
And I can imagine Morgan Freeman, saying,
yeah. It was really pretty. I think it might have been the what do you call it? The Tom Cruise War of the Worlds.
Oh, okay.
Yeah.
So why do you suppose, or what do you suppose is being done to protect from potential microbes that we could carry? Or is it just like, Santhosh, what sort of protective gear are you wearing when you work with animals? Or do you just not care because you're like, well, whatever, I'm not catching some random mouse disease?
Dude, you're going to get me caught by my like IRB and stuff. No. So, okay. If I'm working with what's called biosafety level 2, which is what I have to when I put infectious agents into a mouse and then I'm experimenting with the mouse. So I have to have, first of all, proper clothes on underneath, which is a long sleeve shirt, no open-toed shoes. I got to wear a lab coat. And if I'm not dealing with fire, but I'm dealing with fluids, it has to be splash proof, double glove. And because it's the time of COVID, I'm also wearing a mask and possibly like not heavy duty goggles, but at least some eye protection in case there's a splash to my eyes.
And now we've circled back again to what does the standard representation of an alien look like?
Oh, so are they wearing a mask? Are they wearing a mask?
Yeah.
That's what that gray with the dark eyes. It's a helmet.
Yeah. And of course we can also look at our other famous alien movie everybody knows, Independence. And there they talk about a computer virus that brings them down rather than a human virus. But
I thought it was Randy Quaid.
Right. Let's talk about what you said, biosafety levels, Santhosh. What are the different biosafety levels? What sort of equipment is required to do these kinds of research? And then let's look at the parallels between these and the stories. So it sounds like from your description, humans would be a biosafety hazard level 2 to this hypothetical race.
At least, but there's variability there.
At minimum, dude.
So what are the standard microbes carried around in every human that you think could pose the biggest danger to extraterrestrial life?
Okay, so
and some of this, and I'm gonna just interject right for a moment. Some of this I'd also like to hear Eleanor's take on, because we've talked in the past about how microbes react differently in microgravity.
Ah, yes.
That's true. That's true. Okay, so 4 big categories that we always deal with: viruses, bacteria, fungi, and eukaryotic pathogens. Those are usually how we break it down in infectious diseases. So we carry a host of viruses, but probably the scariest are herpes viruses because they stay latent in parts of our system forever. So HSV1 and 2, cytomegalovirus, Epstein-Barr can all be not only lethal and like to invade especially the central nervous system, but they also like to cause cancers after they establish latency in cells. So that's number 1, viruses. And we've got cold viruses, of course, like the ones that kill the War of the Worlds aliens. Bacteria, and we've talked about this too, Josh, and this is one where I can stop and let Eleanor chime in. We are somewhere between 5 times of our human cells, so-called human cells, anywhere between 5 times to 10 times that amount is actually bacterial cells. So on our skin, in our gut, we are much more bacteria than human. And the very conservative estimate says we are at least 1-to-1. So we're like half bacteria. So, and I think this is what's been studied the most in terms of what bacteria do in microgravity.
Yeah, just thinking about this, they always talk about an abduction being taken up to the ship. So does that ship have artificial gravity, or is it have, are you floating around? I think the prevailing abduction scenarios don't really talk about floating around necessarily. So if they have some sort of artificial gravity, then maybe some of the effects that they've documented with E. coli or Staph aureus in microgravity wouldn't apply.
And what are those effects? It's been a hot minute since we've had a chance to discuss them.
Well, what's been documented by both the Russians and the U.S. is that gram-negative bacteria they can grow much more avidly. They can actually increase virulence factors, like salmonella can do that in microgravity. I believe it's Staph aureus can grow thicker cell walls, or like E. coli can grow more avidly. So all of this can point to increased resistance potentially to antibiotic therapy. So
allow me to put forward a hypothesis.
Okay.
You're out in space, and these people all have a sensation of being unable to move, perhaps strapped down if there's no artificial gravity. Your microbiome, just your natural gut microbiome, is full of gram-negative bacteria that are by now colonizing and or harmless to us, but once we're in a microgravity environment, could rapidly become not necessarily virulent to us, but could grow larger, not to mention anybody who's carrying around just a casual stomach bug, or, goodness forbid, a community-acquired case of maybe C. diff.
Oh, yeah. Or they don't actually have to necessarily have C. diff colitis. They could just be colonized with C. diff. It'd be at low amounts, but they could just be like, it's just hanging out, not causing any problems for the...
Or colonized with MRSA.
Yeah. So now you have a human who may be producing rapid amounts of gram-negative bacteria with an unknown effect on whatever this alien race is. Mm-hmm. And maybe due to the sedation, due to the anxiety, due to whatever, this human is, for lack of a better word, pooping themselves.
Yeah, absolutely.
You know what this would be a good time to do if you were an alien clinician? Insert a rectal tube.
Probe.
Yeah.
Because you don't want all that highly biohazardous, potentially contaminating material in your alien operating room, exposing you and your workers to the extraterrestrial equivalent of OSHA violations.
And not only that, a lot of these bacteria, they love to sporulate. They adhere really well to surfaces, and they are. And Eleanor, I'm sure you've worked on this in like infection control. They are murder to try and eradicate once they're stuck to your walls and your sheets and everything else,
and your vents and your flying saucer.
Yeah,
area.
you're gonna have to burn the ship.
or irradiate it or flood it with ethylene oxide.
Sure. Yeah. In fact, that would be the only, the only way that it would be okay is if those, the aliens actually were comfortable breathing some of those gases which were very noxious to us, as well as those bacteria. But if they were fine with just like flooding that everywhere, then they could kill this stuff en masse very quickly. But I can't imagine that being compatible with a lot of different, forms of life.
Well, again, so now we have a possible reason for anal probes beyond just aliens getting their perverse jollies.
Sure. Well...
And without them trying to collect without it being a sexual or an organ or a clone thing, just a simple matter of protecting yourself from infection. Is it overkill? I mean, maybe. But I think we've now worked our way through like maybe their physical appearance, as well as at least a possible explanation for anal probes, as well as the random sampling of rural populations to experiment on.
They're so misunderstood.
It's all coming together.
It's all coming together.
So, can you guys think of any other medical studies or things that you would want to do as an alien, or that we could explain away that people have had done to them? Have we covered all the tropes?
The only thing we haven't covered is there have been reports of women being impregnated.
Oh, yeah, that's the old, they took me up there and they left an alien baby in me.
Exactly.
That's ripped from the tabloid headlines, yeah.
Yeah.
Now,
yeah.
the vast majority of these babies have all been human, right? At least in... No, I'm
Vast
saying in
majority
appearance.
Meaning like 100%? Yeah.
Meaning not hoaxes, not some, animal or calf that is being presented, because there are medical reports in our own history of women trying to pass off non-human births as their own. Like one woman claimed to have given birth to something like 20 rabbits and 2 goats, and it's actually a really fascinating case report, which I'll link if I can find.
Or Bat Boy.
Yeah. So, the people who claim to be pregnant, the first question would be, did they actually give birth? Second, was anyone there to witness it? Third, what did they give birth to if so?
Okay, that's very fair. Absolutely. But I think that's a really good point. Essentially, any life form, is going to be born. So it'd be interesting to study that. It would be interesting to study how they consume energy. So their nutrition, how they grow, mature, how they reproduce, because that's an essential part of anything's life cycle is its reproductive habits. And then finally, it's the scary part. It's like how they die, like what kills them. So, a lot of what we talk about, natural predators, what's toxic to it, what can it stand? Like, for instance, Eleanor, the poor tardigrade, right? Like the water bear. Like, we've done everything to this poor little thing to see, like, how do you die? We've desiccated it, we've irradiated it, we've rehydrated it. And so
it just won't croak.
Yeah. So going back to these these women who claim to be abducted and then impregnated.
Yeah.
I'd
no
also
one's
want
ever
to know.
given birth to a tardigrade.
Right. So I want to know again. The first kind of questions you'd want to design a study around would be tracking. How many of them who claimed to be impregnated gave birth? How many had witnesses to that birth and what was born? You could look at the genetics. You'd also want to know how many of that population specifically was re-abducted. Because if you are impregnating and you're not including some sort of monitoring device, which presumably could be detected by our science now, if not in the 60s, you're going to need to bring them back for the equivalent of alien visits for checkups to see how your experiment is going.
Right. Mm-hmm. I don't know if I've ever heard of children of abductees being abducted.
Yeah, is being abducted genetic? Do they follow bloodlines? That could tell us about how long the aliens themselves may live. What's the species memory for returning to an experiment? Santhosh, you last about 2 weeks, right?
Oh, yeah. Yeah.
Before you're like, oh shit, what was I doing again?
Yeah. 2 minutes, yeah.
So I think looking at whether or not you want to accept alien abductions is real, I think analyzing the commonalities among our abductees can tell us a lot about the hypothetical race doing all the abducting. Maybe different aliens have different areas of Earth staked out, and they're all fighting over. Maybe it's just different departments in one alien science academy.
Oh my god, dude. When we got all of our COVID patients and we had to divide up, like, okay, I have, this much phlegm from Mrs. Johnson in room 218. Who wants it? Yeah, there's like so many people as I need the phlegm. No, I need the phlegm.
I have genetic material from the Appalachians. Oh,
Yeah.
well, I have,
Yeah.
ammonia and urine from Huangtong province.
Yeah, yeah.
Um,
Or even, people fighting over telescope time, right, Eleanor? It's like, yeah, I need to use this to scope out the rings of Jupiter. Your rings of Jupiter experiments suck. I want to
Yeah, I
look at
mean,
the Pleiades.
or
exactly.
or grad student scientists. The big academics are just studying us with far off, telescopic lenses, their version of Hubble or Webb. And then the
Sure.
juniors are like, oh, I'm never going to get telescope time. But I bet if I just snuck down to Earth and grabbed some random human off a backcountry road, I could get my paper in real quick and outshine.
That's right. There is
Oh
one
my
other.
God.
There's one other.
Abductee science fraud.
Exactly.
Oh.
There's one other possibility though, and it's kind of like, did you ever see the show The 4400?
Oh, yes.
Oh, I
So
haven't seen this
so
one.
maybe these abductions are actually us from the future coming back to take humans and then augment them to come back to prevent some future calamity.
And just along the
Oh.
way, we're like, let's just probe them.
And then along the way, let's just add a little anal probe for good measure.
Oh, God.
Hey, John, why are you probing, past Greg? I don't know, just he's unconscious, man. Look at him. It'd be
Yeah.
funny.
It'd be
Why not?
funny.
And then, and then future Greg's like, no, man, don't worry about it. After all, this is what everyone remembers, right? We have to do it for science to preserve the timeline.
Did you staple your initials into that human? That's not important.
That covers every possible aspect of abduction.
Boy, I hope so. I don't think there's anything left.
We've probed it to death.
And I think we gave a pretty thorough analysis of all the reasons for the frequent medical procedures that seem to be performed. But if you listening at home can think of any others or have a different explanation, we would love to hear it. So that's it for this week and this year's Halloween episode.
Oh, there. That's like Eleanor's aloha. It means hello and goodbye.
That was her going to rejoin her home planet with ideas of how to design a better study for the next time around.
That's right.
Oh no!
Planet
We've given away all the secrets. Why?
As always, we'd love to hear your comments, questions, and feedback. The show is produced by me with a lot of help from Dr. Santhosh and friends. Our theme music is composed by Rachel Leisure. Like and subscribe anywhere your podcasts are downloaded, abducted, or experimented upon.
Yeah.
And until next time, wash your hands, wear a mask, get your shot, and find somewhere to travel to on this planet or another. Wear clean underwear just in case.
Just like your mother told you.
And until next time, as always, happy travels.
Bye, everybody.
Bye-bye.